Hello, I'm Julie Burns, President and CEO of the Rise Massachusetts Foundation. We are a statewide nonprofit organization focused solely on ending the opioid crisis, and one of our key strategies is investing in harm reduction. Opioid use disorder is a treatable illness. Untreated, however, the disease can have tragic consequences, including death. At Rise, a large part of our strategy builds up and supports harm reduction services and makes them an equal part of the treatment process for opioid use disorder. For 4 years now, we've been supporting organizations, large and small, that are doing groundbreaking, yet sometimes thankless work all across the Commonwealth. And the evidence shows that harm reduction works. It keeps people safe until they're ready to engage in treatment if that's their goal. In fact, people who work with a harm reduction service provider, be it a syringe exchange or mobile program, are much more likely to go into treatment than those who do not. We are honored to support the work of these frontline public health heroes. Take a listen.
Harm reduction is important because abstinence is not everybody's goal.
Harm reduction is important because the current system for folks who are using drugs is incredibly broken, and in fact is based in the concepts of control and compliance and punishment as a means of helping people.
People think of harm reduction, so I think sometimes as like what you do with an individual in that moment. You give them clean syringes, you give them Narcan, you get them into treatment. And that's true, right? But harm reduction is about the broader community, and it's about addressing so much more than just the person in front of you.
I think the general public benefits from harm reduction because everyone out here on the street, everyone of our participants, everyone that you know that uses drugs is someone's family.
The data proves that it actually is beneficial to have a harm reduction program in your area or neighborhood. There's less syringes in the area, decreases drug-related crime.
I truly believe trauma is a gateway drug for most people.
The reality is nobody has to die from drug overdose.
The best 3 words for me that describe harm reduction are compassion, education, and community.
Pragmatic, evidence-based, and love.
Empowerment, dignity, and respect.
Any positive change.
Love, compassion, and dignity.
Reality, love, and evidence.
Rise has been so beneficial for us in terms of allowing us to really kind of choose what we need from their funding and their partnership. They've helped us be able to fund our outreach van, buy it, and then of course take care of it, and also our outreach workers. Of course, the benefits of outreach are so huge. Being able to meet more people in the community instead of expecting them to come into this brick and mortar site.
We also provide a drug checking service. Clients can come in, bring their substances in, and get them tested to find out exactly what's in their substance so that they can use the safe way, or the safest way as possible.
Rise is a part of our family. They have been so responsive in funding what's really truly relevant to what's going on in our community, especially over the last year. During the shutdown of the pandemic, we opened up a service window so we could continue offer harm reduction services at a distance, kind of through the front of our building. It really has been a true gateway to other services, that if someone is coming and accessing syringe services, picking up Narcan, asking for some kind of help, hygiene products, that those relationships are just built, and we start to understand what are the other needs that that person has.
Because they took a chance on us, we were able to distribute 1 million syringes in our area.
Rise was willing to listen to new ideas and support them.
I'm really grateful for Rise. They're willing to take risks that maybe like institutionalized public health isn't. When I've approached Rise and said, hey, I have this crazy idea, how do you feel about maybe funding one of the first frontline drug checking programs in the country? And they were like, yeah. And I was like, really? Like, this is, like, I was just shocked and also grateful.
They took a chance on us, and they helped us when we were really just starting with this.
There is somebody out there, there are people out there, there's a foundation of people out there who believe in the work that we do without equivocation. And it's something that is like giving the team a lot of hope, and it's allowed us to reach a lot more people that we weren't reaching before. So I'm grateful that they've helped us do that. I really mean that. Like, I fucking love them.